Hi, in this video we will be learning the pathology of ischemic heart disease. So basically from first year we always have a confusion about what does ischemia means, what does infarction mean, what's the difference between heart attack, myocardial infarction. All those things will get cleared in this video. So make sure you understand it and understand the foundation of this concept so that you can apply it anywhere else when you study the pathology of it in detail or when you do internal medicine or whatever subject in the future. So this video is about ischemic heart disease. So what happens in an ischemic heart disease? The perfusion is not equal to demand. So what does perfusion mean? Many of us do not know what does perfusion mean. Perfusion means the amount of blood delivered to a specific organ or a tissue, okay, and the amount of oxygen or nutrients that is being sufficiently delivered to an organ or a tissue. That is perfusion through blood. Demand is the amount of blood or oxygen, the nutrients required by the tissue for it to function well. So perfusion is the amount of blood delivered, and demand is the amount of oxygen or nutrients required by the tissue to function to its normal levels. Okay, so what happens in ischemic heart disease? Due to some reasons, the perfusion is not equal to the demand of blood supply. So that could be due to a block, it could be due to a plaque buildup, it could be due to thrombus or any external factors. So let's look at it in more detail, understand the pathology behind it. For example, take this as a blood vessel, okay, and this is your tissue. These are two cells. So if there is a block that obstructs this blood vessel, then there is going to be less blood flow through this artery, right? The blood flow through this artery is going to reduce. So if the blood flow through this artery reduces, that means there is less oxygen reaching these cells, and at the same time that means there is less nutrients reaching these cells. So as a result, the cell will not be able to function properly, and over time it will undergo necrosis. Necrosis is nothing but it eventually is going to lead to cell death. It's like degradation of your cell or your tissue is called your necrosis, right? Now some facts to remember here is that when your block is about 70% or greater than 70%, that is called critical stenosis. If you watch the previous video, stenosis means there is blockage, okay, blockage of the artery, stenosis. Okay, if it reaches around 70 or more than 70, that is called critical stenosis. And where does this blockage usually happen? Most commonly it happens in our coronary artery. Which coronary artery specifically? It happens in the left anterior descending artery, left circumflex artery, and your right coronary artery. Okay, this is a fact you have to remember, and this is very simple. There is no need for a big explanation as to why there is necrosis here. It's obviously because of the blockage, and the blockage leads to less supply of blood, hence less supply of oxygen and less supply of nutrients. Okay, now what does this necrosis lead to? This necrosis causes a lot of problems. Okay, it can lead to myocardial infarction, it can lead to angina pectoris, it can lead to chronic ischemic heart disease, or it can lead to sudden cardiac death. Everything is interlinked to each other. Let's look at how every one of them is linked to each other because of your ischemic heart disease. So before we go to that, let's look at what's the difference between ischemia and infarction. Everyone's had this confusion, even I've had this confusion, but making this clear is really essential. Let's look at what's the difference between them. Ischemia means there is decreased blood flow to a portion of your body, or let's say to a portion of a tissue, okay? And it's reversible. If the obstruction or the problem that's causing less blood flow is removed, ischemia is reversible. And ischemia leads to angina. Angina means chest pain. We'll look more about it later in this video. Okay, so ischemia is less blood flow, reversible, and it can cause angina. What is infarction? When ischemia is prolonged and when it's not able to be reversed, that can lead to cell death because of your necrosis, right? And that becomes irreversible. When cells die in important organs, that is irreversible. So this is infarction. And usually when ischemia becomes infarction, you have the case of heart attack, which is also called as myocardial infarction. So you don't have to confuse between understanding what is heart attack and myocardial infarction. They both are the same. So when there is cell death due to necrosis, and when it becomes irreversible due to some block, atherosclerosis or a plaque or a thrombus, it leads to infarction. First it leads to ischemia, and that leads to infarction if it's not reversible. Then that causes your heart attack, which is also called as your myocardial infarction. It's very essential to understand the difference between these two. Okay. Now, as I said, I'll be talking about angina pectoris too. Angina pectoris is the medical term for chest pain. Okay. There is tightness or pain in your chest. So, where does this pain originate from? It comes from the substernal place and your precordial. Both mean, precordial means just before the heart, substernal means behind the sternum where the heart is located. So, there is discomfort over there. There is tightness. There is some sort of pain over there, squeezing pain. Okay, and this is due to transient ischemia. So remember, ischemia is just decreased blood flow, and hence, and let's say a thrombus goes to the coronary artery and it blocks it for a while and it just dissipates to another part, and it takes some more time for it to obstruct the blood vessel to where it's going, right? So that's called transient ischemia. This transient ischemia leads to something called as your angina pectoris, and this lasts for around 15 seconds to 15 minutes. Okay, and there is no necrosis seen in this because it's just transient. Okay, this transient ischemia, the blood supply is reduced, is increased or is compensated after some point of time. Now that is angina pectoris. Now let's look at why this pain is caused. Blood is getting blocked, the flow of blood, but because of that, why is there pain? Pain is related to your nervous system, right? Let's look at it why. If there is ischemia, that means your tissue is undergoing stress. And if the tissue is under stress, then that leads to the release of some chemical substances like your adenosine and bradykinin. What this adenosine and bradykinin does is it stimulates your sympathetic nervous system and vagal afferent nerves. And that stimulation causes a squeezing discomfort, or eventually it causes some sort of pain, a squeezing pain, tightness in your chest. So ischemia, stress, that leads to release of adenosine and bradykinin, which stimulates the sympathetic nervous system, that causes your pain. Alright, that is angina pectoris. Now there are three types of angina pectoris, two of which are very important, which is your stable and your unstable. Okay, in stable, the plaque is strong. It stays in one place. It does not dissipate anywhere else. It just stays in one place. Okay, so it does not happen when the patient is resting, and the pain is usually crushing and squeezing kind of pain. And this stable angina is usually referred to your left arm, the medial border of your left arm and hand, up till your fingers, okay, and your shoulder. Alright, and even to your jaw and to your occiput. Fine. This image is really important. Take a look at where the stable angina pain is referred to. And this medial part also is very important for clinical purposes. Okay. Now what about unstable? Unstable is when this plaque ruptures and goes to other parts as your thrombi or emboli. So there's thrombosis happening. And this pain usually lasts for more than 50 minutes, essentially for more than 20 minutes in duration. Now there is something called as variant angina, also known as your Prinzmetal variant. That is a transient and a rare one, because that is due to the spasm of coronary artery, not due to a blockage or any thrombus or emboli. Okay, it's due to a spasm of your coronary artery, and it's very uncommon. Now, let's talk about myocardial infarction in detail and see what really happens. Okay, so what is myocardial infarction? It is heart attack. You know that now. Okay, it is due to coronary artery obstruction, prolonged ischemia that causes your infarction, and if it's happening at the heart to the myocardial layer, then that's called your myocardial infarction. Now, what really happens? If there is ischemia, there is infarction, there is myocardial dysfunction, right? The cells are not going to function well. After some point, the cells are going to die, myocyte death. And if the cells die, the surrounding cells will make use of anaerobic metabolism. The cells that are about to die or the cells that are dead will make use of anaerobic metabolism because the mitochondria and everything is destroyed. So aerobic metabolism is not possible here. So it will take the route of anaerobic metabolism and it will start producing lactic acid, which is a byproduct of your anaerobic metabolism. Lactic acid, along with other noxious metabolites produced by your anaerobic metabolism, what they do, they go to the membrane of the heart cell. What is that membrane called? That is called your sarcolemma. So they go to the membrane of your heart cell, which is called your sarcolemma, and they destroy the integrity of the sarcolemmal membrane. So if the membrane is destroyed, as a result, proteins leak out of the cell, right? So there is loss of myocardial proteins, specifically your troponins. And that's why troponin levels are high after a myocardial infarction. Now, here are some features you should know. I have taken this snip out of the Robbins book. The onset of ATP depletion just happens in seconds after myocardial infarction. The loss of contractility of that specific tissue will be lost in less than 2 minutes. ATP is reduced to 50% normal in 10 minutes, 10% normal in 40 minutes. There is irreversible cell injury in just 20 to 40 minutes of MI, and there is microvascular injury in greater than 1 hour. Now take a look at this diagram and understand how this necrosis proceeds. First, there is an obstructed coronary artery. This is the zone of perfusion, and this is the area at risk. Okay, now that prolongs, and see how the necrosis forms, and it expands all throughout the area. 0 hours, 2 hours, and 24 hours. It progresses. Okay, so the sooner we intervene, the better for the patient. Now, there are some types of infarctions: transmural, subendocardial, multifocal, microinfarctions. These could be due to certain specific reasons. Usually, transmural infarctions that involve all the layers of the heart is due to atherosclerosis. Okay, subendocardial infarctions are due to plaque ruptures. Multifocal microinfarctions are due to spasms, cocaine use, or epinephrine. Okay, what are all the clinical manifestations that you will see in a patient presenting with myocardial infarction or your heart attack? Number one, chest pain, very classic, angina pectoris. And then rapid and weak pulse. The pulse will be rapid, quick, but it will be very weak, very subtle, very feeble to feel. Okay, and then there will be diaphoresis, sweating. Okay, excessive sweating. There will be nausea, feeling like vomiting, and then dyspnea, difficulty of breathing. And as I said, troponin levels will go up in 2 to 4 hours, and they will peak in 24 to 48 hours after your myocardial infarction starts. Okay, to summarize what ischemic heart disease is the coronary artery disease, the artery is getting occluded. As a result, you have myocardial ischemia. There is plaque change, there is thrombosis, the ischemia and the severity is increased. That leads to infarction with muscle loss. There could be arrhythmias. If all of that happens, there is infarct healing, scar formation, the ventricles remodel, there is hypertrophy or dilation of the viable muscle. To compensate, that can lead to chronic ischemic heart disease. Myocardial ischemia, if left for a while untreated, can lead to chronic ischemic heart disease. All these things can lead to congestive heart failure, and ultimately can all lead to sudden cardiac death. Now, congestive heart failure, hypertrophy, dilation of the dilative cardiomyopathy, they are all separate topics in itself, which will be discussed in future videos. Now, I really hope you got an understanding of what an ischemia is, what an infarction is, what a heart attack is, and what is the real mechanism behind myocardial infarction. I hope you need not memorize this hereafter again, just understand the concept behind it and apply it wherever it's required. I hope this video really helped. Thank you.